I'm Dr. Rick Greene from the UVA Medical School class of 1970, and it's my pleasure to host this series, which is dedicated to featuring our wonderful professors at UVA. And it's my real pleasure today to welcome Dr. Nancy McDaniel, Professor of Pediatrics, area specifically in pediatric cardiology. So Nancy, thank you for being with us.
Thank you for inviting me.
So I wanted to ask you, I know that you went to nursing school here,
I did.
got a BS in nursing,
Mm-hmm.
and tell us a little about going to nursing school and then your concepts of transitioning into medicine.
Well, I went to University of Virginia undergrad as well. Started out pre-med, but somehow was convinced by a chemistry professor that I might not be be good med school material.
Was this an organic chemistry
Oh,
professor?
no, just general chemistry. General chemistry. But I had maybe a little lack of confidence there for a while, and I went to nursing school, which I value every day in my practice and teaching. But once I was in nursing school, I decided I wanted to know more anatomy, more physiology, more pharmacology. But I learned valuable things there and transitioned, I think, easily into the School of Medicine. But it was I couldn't wait to get to the clinical part of medical school. But that's kind of how it worked. But when I was a nurse at UVA, and I met many medical students and professors when I was a nurse, I took care of a small child who was cyanotic. And he's still in our practice, and it was an inspiration. It was like, I want to know more about that.
I was going to ask you how you gravitated to the cardiology side of pediatrics.
But it was mostly around this patient started me to be interested in cardiology, and then I loved the physiology, the anatomy of the heart, and it was a natural fit. So, and I had wonderful mentors.
Martha Carpenter?
Of course, and she was on the admissions committee when I applied to medical school.
Right. Of course, she was here when I was a student. Where are you from?
I grew up mostly in Lynchburg, Virginia. My father was in the Army, so we moved a bit before that.
So you knew about the university. I mean,
I did.
Yeah, so this was something that...
Yeah, I announced when we moved here, I was starting 4th grade, I said, that's where I want to go to school. My parents said, not possible, because at that time there were no women undergraduates, but by the time I applied, I was in the 3rd class of undergraduate women here.
What is it about Charlottesville as a place to live that really grabs you? I mean, I obviously, I always like to ask people, you know, why they're happy to be here.
Oh, I think it's a wonderful place to live. Coming here, I was listening to a program on NPR on joy. I think Charlottesville brings a lot of joy to most people who live here. I now live out in Nelliesford at Wintergreen, and just driving home, seeing the mountains, it's a beautiful place, and I think having a large university in a small town is also lovely. We have lots of things here that we wouldn't have in another town this size.
Tell me a little about what you're doing now.
Well, I'm recently retired as of March, and our yard looks better than it ever has. My husband and I are enjoying gardening. You know, it has turned from a chore, you know, take care of the yard, to something that is also joyful. So that's fun, and we travel. And that's also just, you know, a source of wonder. So that's fun. And I, like many retired physicians, I'm 90% retired, but I'm helping my colleagues out in pediatric cardiology. They're down a faculty member, so I'm helping out in clinic, and I just see well children, nothing complicated, and then I help teach still.
Well, that's wonderful. So you really are engaged.
I am, and I'm happy to be part of, you know, the medical school still.
Absolutely, absolutely. You've seen changes, obviously, in the care of children for cardiac issues. What are the major things that you've seen? Where are we going in cardiac care for children? It's not all surgery, obviously. There's other things involved. What are your thoughts about, for if you're talking to a student or a resident who's interested in a subspecialty? You know?
Well, I think just like what interested me in the beginning, the anatomy and the physiology, that's still critical to the understanding of pediatric cardiology. You still need a stethoscope, I think, but taking the anatomy and physiology, putting that with the echo. I think the thing that's really different now is most of the patients we meet when they're still in utero. So the mother is referred for fetal ultrasound. That has really changed things, so we can plan and have the mother and the baby be as safe as possible. When I was a fellow, babies would come from all over, and by the time they got here, they were not as healthy as they could be. So that's really changed things.
Of course, one of the things that you've seen probably is the number of women coming into medical school. I certainly have seen it in surgery, going into surgery. What do you tell a young student? You're still teaching. What do you tell students about opportunities, certainly in pediatrics and your specialty area?
Well, pediatrics has probably went from 50-50 gender distribution when I was in residency to now it's about 80% women. OBGYN is the same, more women than men. I just encourage students to kind of follow their passion, follow their dream, and if that's to be a surgeon, be they a man or a woman, that's what they should do. I encourage them to think broadly, you know, about what they want to do. I did this small group teaching for many years, and I like to, I had a little card where I wrote down what I thought the students were going to be, you know, from the first semester to what they became. I was pretty good, not always, but I think the sky's the limit. There's so many opportunities, and I think now the surgical class here in the trainees is maybe more women than men in general surgery. It's amazing.
So you've really enjoyed teaching. I mean, teaching is something I think, even though we haven't known each other, it seems to come through to me that you've enjoyed that interaction.
And that's what I didn't do any medicine for about 6 months after I retired. And when I sat down to say, what do I miss? I missed the students the most. Mm-hmm. And then I missed the contact with the children and the families. Didn't miss the administrative part of my job, but the students are great. I just see such, you know, the future's bright.
Absolutely. Do you still get involved in organizational activities, organizations that you went to, say, 10, 15 years ago, or is that?
That's only a very little bit. In my last year at UVA, I did a small research project, so I just presented it at the American Academy of Pediatrics, me and all the young people presenting.
Yeah. Yeah.
It was fun. It was fun. But I saw former residents, former students. It was great.
That's excellent. Well, it's such a pleasure to talk with you and to hear about what you've been doing, especially this transition from a nursing background, and clearly that was important to you. I mean, it brought a lot of things into medicine.
Oh, it did. Very well-rounded picture for me.
Exactly. And I want to thank you for everything you've done at the university. And again, we've been talking to Dr. Nancy McDaniel, who's a wonderful pediatrician, pediatric cardiologist, and as she transitions into doing some wonderful other things in her career. So thank you very much for being with us.
Thank you.
I appreciate it very much.
Thank you very much.
Thank you.